Hi, I'm Dr. Daniel Hoover with Beach TV's Tai Chi for Beginners. Today's segment is on cupping and fire cupping. You will get to witness an actual traditional fire cupping session here and learn about all the amazing benefits of traditional cupping. A lot of people ask me, what is cupping and how does it work? Well, what we're going to be doing in a moment is creating suction under these cups, and what it does is draw fresh oxygenated blood in and through the injured tissues, allowing them to heal more quickly. And at the same time, that suction is going to draw the toxins and lactic acid from the injured tissues so that it can be recirculated and eliminated from the body. One of the things I like to do before cupping is put lotion over the area. It'll help the cups seal to the skin a lot better. So Dustin, I'm gonna put some lotion on your skin. It might be a little bit cool, okay? So just apply the lotion, and this is going to help the cups to seal and stay. We don't want the cups falling off. We're going to begin the cupping. I have an alcohol-soaked cotton ball here, and we're just going to get started. We're going to just jump right in and begin. So when we cup, we put the flame in, and that combusts the oxygen inside the cup, creating the suction. The longer I keep the flame inside, the stronger the suction. If it's a sensitive area, I'll just put it in gently, quickly, like this. Now, I want to look and see, is this cup too strong? When we cup, we can have a high or strong suction, or medium, or light. As you can see, I'm letting some of the air back in so that it's to the patient's tolerance. Now, with an athlete who lifts weights and trains regularly, like this strong man here, we want to help break up the scar tissue and the adhesions. So by simply moving the cup over the skin like this, it's pulling the fascia. It's pulling the fascia away from the muscle and allowing more circulation to get into the area. Are any of these cups too strong or bothering you?
No, they feel good.
Great. So what I'm going to do is I'm going to cup the entire back, and we're going to use this as a diagnostic procedure. As you can see, there's some red marks here. If I just take this one off here, you can see it's a little bit red. Sometimes it's purple. And that's telling us something. That's blood stagnation. Think about getting a Charlie horse. You just got a big bruise in the belly of the muscle. You healed, you move on with life, but that deep purple bruise, that blood stagnation deep in the belly of the muscle never got out, never got back into normal circulation. Well, these cups will draw that old stagnation through the muscle, and then it can be eliminated. So this is diagnostic. As I start to place these cups, we're going to see where is there stagnation with this patient. So let's have a look. We already see on the low back that there is some stagnation, which is common. What's interesting to me is how when we cup the area a second time in a week or two, it won't be as purple, meaning we removed that stagnation. We got that blood, that bruise, out of the area, and the area has improved. How do we decide which areas we're going to cup? Certainly it depends on the injury. Is it an acute or chronic injury? Also, we use acupuncture points. I'll use the origins, insertions, and belly of the muscle to determine where I'm going to place these cups. You can see we have different size cups to get into areas that might be a little more challenging, like up here in the shoulder. And then I'll just slide it to the area that I want. Working on the supraspinatus, which is a common area where people have injuries to their shoulders. One of the questions I often get is, does it burn? Is it uncomfortable? What the patient will feel is just a little bit of warmth. If you just moved a flame by your hand, it's just like that, just a little warm for a moment. And you might see that the skin is starting to go up into this cup here. That's normal. That's what we want. We want it to bring the skin and the blood to the surface so the body can heal. We know that our healing is directly proportional to the free flow of blood, nerve impulses, and chi. We also know from the classics that the chi follows the blood. So by moving the blood with these cups, we're also moving the chi in the body. And I'm going to pick specific points on the body, acupuncture points, to cup to help facilitate healing. Now, I know this patient. He's very strong. He works out regularly. He's also an Ironman. And so I know some common conditions that we would want to address. And the paraspinal muscles along the back are going to be very tight and need recovery. So this is a great way to quickly recover sore muscles because we're bringing fresh blood and pulling out the lactic acid. As we can see, the cups are facilitating healing, and they're also helping us identify where there is a problem. What I just showed you is the fire cupping. Now I want to demonstrate the most common form of cupping, which is the suction cup using a pump. Now, people ask me, which one is better? In terms of creating the negative pressure to enhance the blood flow, the difference between the two, I would say, is negligible. But if you want to get into the subtle energy of it, using the fire element and the warmth that comes with the fire, you might get a little bit more of a therapeutic effect, but ultimately it is negligible. And if you're getting cupping with these, you are getting a good treatment. You're not missing anything. I think really the fire cupping is more fun for the practitioner because I love playing with fire at work. When you get cupping, know that you are being treated like an Olympian because this is now the best practice to help our Olympians and professional athletes recover quickly so they can stay in the game and have their best performance. So for some of you viewing cupping and these marks for the first time, it might look like this hurts, but it actually doesn't. Dustin, how does this feel? Are you in any pain?
No pain at all.
No pain at all. Our bodies tend to get stiff. It's not just because our muscles are tight, it's because the fascia is like the saran wrap that surrounds the muscle. So if we can get the saran wrap that's tight around the muscle, we want the muscle to glide easily. If it's stuck, we need to find a way to separate that layer of fascia so the muscle can glide easily. And that's one of the things that we're doing to help the mobility of the musculoskeletal system. But how really is this going to help us heal? Let me show you with this cup. Now, I've mentioned before that we know healing is directly proportional to enhanced blood flow. So when I just create this negative pressure here, instantaneously you see there's more blood flow to the area. Therefore, healing. It's bringing the growth factors, our own stem cells, and collagen, our immune system, our white blood cells, everything is rushing to this area. It's signaling to the brain, hey, pay attention here. The reason why we don't have the healing that we want is we're not getting the life force or chi, the blood, and the nerve impulses to that area. With the cupping, we're able to do that in more than one way. One of the best ways to use cupping is on shoulders. I've found clinically when somebody has a chronic shoulder injury and they've tried everything, they've done their physical therapy, chiropractic, even acupuncture, maybe some trigger point injections, and it's just not healing the way that they want or that we want. For some reason, the cupping is really the thing that gets them to the other side. And if you think about it, the shoulder is a complex joint and nothing's really getting in there to help with the circulation. So if we could just pull and rather than push, massage is pushing and stretching. Where in the healing world do we have drawing of fresh oxygenated blood? That's the difference. With integrative medicine, we're combining different modalities to help the body heal as quickly as possible. So pressure change is another one that we need to include. Every modality has its place in integrative medicine. Cupping is just one of them. It's one tool that supports the body. It's great for musculoskeletal, ligament, tendon, pain, myofascial pain, but it has its limitations. So you want to find a way to incorporate cupping into your overall healing. I hope that you take the opportunity to try cupping yourself. Thank you.